friends from media, Mr. Sudarshan, VP Marketing, Apollo Hospitals, Chennai region, Mr. Kingsley, Senior General Manager, Apollo Specialty Hospitals, Vanagaram, Ms. Suganti, PRO, Apollo Hospitals, Chennai region. A very warm welcome to everyone. Today's press meet is to reveal about Apollo Neighborhood Connect, an initiative of Apollo Specialty Hospitals, Vanagaram. It's world's first such comprehensive community connect program, which is a rare of its kind. It's my privilege to welcome two young dynamic doctors. One is Dr. Dawapalani, who is the head of medical services, Apollo Hospitals Chennai division. Another doctor is Dr. Prabhash, senior consultant neurologist, Apollo Specialty Hospital, Vanagaram, who is specialized in stroke, who will share more details with media friends. Over to Dr. Prabhash.
I'm Dr. Prabhash, consultant in neurology, Apollo Hospitals, Vanagaram. I'm a stroke specialist. So I'll be talking on two things. One, the story behind this novel concept of Apollo Neighbourhood Connect. And two, in short, about a brief discussion about what is newer advances in stroke management. So the story is like this. We started our comprehensive stroke care center in Apollo 2.5 years ago. Previously, maybe if you consider 2 decades ago, stroke treatment, there was not much. ஒன்றும் பெருசாக பண்ண முடியாது. அதிகபட்சமாக என்ன பண்ண முடியும்னா அது ஸ்ட்ரோக் எதனால் வந்ததுன்னு கண்டுபிடிச்சு அதோட காரணத்தை ட்ரீட் பண்ணி மேற்கொண்டு வராமல் தடுக்க முடியும். This is what we could do 2 decades ago. But the scene started changing by 90s, end of 90s. So there is something called thrombolysis, அதாவது clot lysing medication கொடுக்கலாம் அப்படின்னு கண்டுபிடிச்சாங்க. So then by over the next decade they improved the skills, and by 2005-2006 that had become gold standard in stroke management. So இந்த மாதிரி ஸ்ட்ரோக்கோட ஒரு 4.5 மணி நேரத்துக்குள்ளே வந்தால் இந்த மருந்து கொடுக்கணும் அப்படின்னு ரூலாகவே பண்ணியிருக்காங்க. So then we started seeing results. But over past 10 years, the newer technique called thrombectomy means we go into the blood vessels through a small arterial puncture in the groin, go to the area of the clot and take the clot out. So this has changed the paradigm shift in stroke management. So முன்னாடி இது ஒரு டைமுக்குள்ளே வந்தாங்கன்னா if we take the clot out, we can actually reverse the stroke symptoms completely. And இது 10 years முன்னாடி வந்தது. And over past 4-5 years, the techniques have improved, the cost has come down, and it is reachable for the masses. So we have, in the background, we started the 2.5 years ago, we started a comprehensive stroke care center in Vanagaram. We have done 58 procedures exactly, and most of them, and we are successful in doing those procedures. So then we thought that we should cut down time inside the hospital. We are all talking about time is brain. We thought procedures how to cut down time. So we did a lot of stroke drills. We, with the help of emergency department and involved the teams, we did a lot of drills to cut down time. We made it down to 7 minutes. A patient, if it comes, we can do the CT, all the procedures. I can do the thrombolysis procedure within 7 minutes. Then we did a lot of teaching inside the hospital, like training the nurses, training the paramedics, the person who's going to pick up the patient in the ambulance. We try to train them so that they come on time prepared. So then we did the Chennai's first patient support group, stroke support group meeting, so that we all learn from our patients. We called in all the 3 patients who are there on that day is available here too. So we learned from them. Okay, what all they, because we see the patient inside. So the relatives, what they feel, how can we improve the system? But whatever we did, we later found that it's not the delay from our side. The delay is because the awareness is abysmally low in India, in our community. They literally, when we talk about stroke, especially one of our patients here told me, stroke, she didn't know anything about it. So we need to, even with that she came on time. So we thought that we should teach the community, we should raise the awareness in the community about stroke. Then we started raising the awareness like pamphlets, all those things we started doing. But then we went around to all the nearby communities. We were giving stroke awareness talks. In one of those talks, one of the patient asked us, one of the member who was present there asked us that, okay, doctor, if a stroke comes, what will we do in this setup? That setup was just a kilometer from our hospital. So we took it home and we all discussed, and that's how this idea was born, the Apollo Stroke. And we thought we will connect the communities. We should connect our neighborhood people around 8 kilometers around our hospital. We will connect directly to the doctor inside the emergency, so that we will try to cut down time. We can prepare things. We know what to do. So that's how this is the concept. So this phone is in the emergency, and these are all connected places in the communities, in the flats. So when an emergency happens, the patient or the relative can take the receiver, press a button. The call come to our emergency. The emergency doctor attends the call, and then in the screen, the details will be shown from which flat, where is the GPS. Those things are available. Actually, it's a two-step process. The initial step, we have kept it simple. Even we have designed, the system is designed in a way that it is GPS coordinated. We will get the details of the secretary of that flat and all those details in one go. If we press a button, the information will go to all the people concerned, including the doctor, the stroke specialist, the interventional specialist, the emergency people. So if we cut down manpower, we cut down time. At one press of a button, the message will go to everyone involved in that team on that day, so that we can cut down time. So the doctor immediately sends the ambulance and picks the patient. So that's the idea behind this. So it's all about cutting time, one, and second, creating awareness. So the moment the people know, okay, there's a stroke or any emergency, you can call this, that cuts down time. So in short about stroke, when this is a neuron. When a building is being built, the brick is the most fundamental thing. Like that, neuron is the most fundamental thing in the nervous system. Consider the brain, the nervous system as a whole. There are around 22 billion neurons in our body. So each minute after stroke onset, you lose 1.9 million each minute after stroke. So imagine the damage which is happening. Second, this is a synapse. All these 22 billion neurons connect with each other. It's not that more number of neurons you are brilliant. More number of synapses you are brilliant. More the connections, it's like we like to learn as cycling. Newer connections, you develop, you learn things. So there are around 157 trillion synapses in a normal person. It will be more in an intelligent person. You lose 13.8 billion each minute after stroke onset. And these are all the wiring inside the brain, which get damaged during stroke. So combining all these things, each hour after stroke, if the patient is 40, and after 1 hour, the damage would have happened, resulted in his brain being 43 years. So that is the calculation which is being done. So 3 years damage in an hour. So what you should do, you should be fast. So be fast is an acronym. This covers 90% of the stroke symptoms. B stands for balance. Any person who was normal suddenly started losing balance. It can be a stroke sign. E for eye. Eye means vision. So any stroke and vision symptoms like double vision, blurring, he cannot see, or something is problematic in the vision, can be a sign of a stroke. F stands for facial asymmetry. Ask the person to put an E. If there is an asymmetry in the face, that can be a sign of stroke. A, arm weakness. கை ரெண்டை தூக்க சொல்லுங்க. ஒரு கையை தூக்க முடியல, இல்லை கை அப்படியே தூக்கும் போது லைட்டாக கீழே போகிற மாதிரி இருக்குது, அது ஸ்ட்ரோக்கோட சைனாக இருக்கலாம். கைங்கிறது காலம். S stands for speech. ஒரு லைனை ரிப்பீட் பண்ண சொல்லுங்கள். ரிப்பீட் பண்ண சொல்லும்போது இஃப் தி பர்சன் இஸ் இது ஒரு ஸ்பெக்ட்ரம் மாதிரி. பர்சன் cannot speak at all. Certain people slurred-ஆக இருக்கும், வார்த்தைக்கு வார்த்தை ஜம்பிள் ஆகிட்டு இருக்கும். ஸோ வாட் இஸ் T? Time. So it's all about time. There are ஸ்ட்ரோக்குங்கிறது 2 டைப் இருக்குது. ஒன்று இந்த ரத்தம் வெடிக்கிறது, ரத்த குழாய் வெடிக்கிறது. ஸோ இது 14%. இதுங்கிறது ரத்த குழாய் அடைகிறது. இதுங்கிறது 80 to 86%. ஸோ நம்ம பேசுகிறது எல்லாமே இந்த இஸ்கெமிக் ஸ்ட்ரோக் பற்றி தான். Actually, the stroke is a misnomer. It is actually confusing things. Heart attack அப்படின்னா எல்லாருக்கும் தெரியும், இம்மீடியட்டாக ஹாஸ்பிட்டல் போகணும், ட்ரீட் பண்ணணும், உயிருக்கு ஆபத்துன்னு எல்லாருக்குமே தெரியும். ஆனால் ஸ்ட்ரோக்குங்கிறது ஒரு மிஸ்நாமர். இன்னொன்று, முன்னாடி காலத்தில் ட்ரீட்மெண்ட் கிடையாதுன்னு சொல்லியிருந்தோம். 20 years முன்னாடி ட்ரீட்மெண்ட், எவ்ரி ஒன் ஹேஸ் அ லேட் பேக் அப்ரோச் டு இட். ஆக்சுவலாக இப்போ நம்ம திருப்பி பண்ண முடியும். we can revert the patient back completely. இப்போ முன்னாடி கிடையாது. 4-5 years we can revert completely. So we should be, so that I think the correct term should be brain attack, not stroke. ஸோ த்ராம்போலைசிஸ் பற்றி ஷார்ட்டாக ஒன்று சொல்லிடுறேன். இது நார்மலாக போயிட்டுருக்க பிளட் வெசல் இந்த இடத்துல பிளாக் ஆகிடுச்சு. ஸோ நம்ம மெடிசின் கொடுக்குறோம். மெடிசின் கொடுத்து அந்த கிளாட்டை லைஸ் பண்ணி we will make the artery clean so that the blood can go to the area which was devoid of blood. இது 4.5 மணி நேரத்துக்குள்ளே கொடுக்கணும். இதான் டேக் ஹோம் மெசேஜ். ப்ளீஸ் டெல் தி பீப்புள் தட் 4.5 hours, within 4.5 hours, if we can reach a stroke ready hospital, not that every hospital, stroke ready hospitalனா த்ராம்போலைஸும் த்ராம்பெக்டமியும் பண்ண முடிகிற ஹாஸ்பிட்டலில் 4.5 மணி நேரத்துக்குள்ளே கூட்டு போனால் we can revert. ரெண்டாவது, இதுதான் த்ராம்பெக்டமி பற்றி நான் பேசுகிறேன். So this is the advanced thing. This is, I told you, 10 years it is there. Now the techniques are improving. Over past 5 years, this has become the gold standard. இது என்ன பண்ணுறோன்னா, we go through the artery to the clot area and then suck it out, take out completely. ஸோ இது நார்மலாக இவ்வளோ நாள் வரைக்கும் 6 hours வரைக்கும் எல்லா பேஷண்ட்டுக்கும், பிளாக் இருக்கிற எந்த பேஷண்ட்டாக இருந்தாலும் 6 மணி நேரத்துக்குள்ள ஹாஸ்பிட்டல் கூட்டு வந்தால் எங்களால் இந்த ப்ரொசீஜர் பண்ண முடிஞ்ச we can revert the patient back to normal. Now recently, இப்போ ஒரு 6 months they have increased it to 24 hours, but then in selected patients, not all can do it, but 6 hours anyone with a clot we can do and revert, but 6 to 24 in selected patients. ஸோ என்ன பண்ணணும்? ஸ்ட்ரோக் வந்தாலும் மேற்கொண்டு வராமல் தடுக்கிறதுக்கும் சரி, இப்போ ஸ்ட்ரோக் வராமல் இருக்கிறதுக்கு என்னென்ன பண்ணணும்? மெயினாக பிளட் ப்ரெஷர் தான். பிளட் ப்ரெஷர் இஸ், ஹைப்பர் டென்ஷன் இஸ் தி மேஜர் காஸ் ஃபார் ஸ்ட்ரோக். மேக் above 30, மேக் ஷுர் தட் யூ மெஷர் யுவர் பிளட் ப்ரெஷர் அட் டைம்ஸ் அண்ட் டேக் கேர் ஆஃப் இட். நம்பர் 2, டொபாக்கோ யூசேஜ். ஓகே, நான் ஸ்மோக் பண்ண மாட்டேன், எனக்கு பிரச்சனை இல்லை. நோவே, உங்கள் ஃப்ரெண்டு ஸ்மோக் பண்ணுறாரா, இஸ் மோர் டேஞ்சரஸ். பிகாஸ் அவர் ஃபில்டரில் ஸ்மோக் பண்ணுறாரு, நம்ம நேராக அதை எடுத்துக்கிறோம். தட் வில் காஸ் மோர் டேமேஜ் டு தி பிளட் வெசல்ஸ். Then air pollution. Now I think in few years down the line, இதெல்லாம் போய்டும். Air pollution will be the major cause for stroke. Cardiac issues, major other heart problems are the one of the most common causes for stroke. Above 30, make sure that you check your heart at times, maybe once in 6 months, so that preventive checkups are pretty important in preventing strokes. Blood sugar, inactive இருக்கிறது, stress, anxiety, poor hygiene, and especially about night work. So in summary, I have only 3 slides. This is what I wanted you to convey. The awareness about stroke in the community is abysmally low, and there is an emergent need to raise it. Now we can revert stroke symptoms. It's not that we are talking about a smaller thing. There is something called number needed to treat, NNT. எந்த ப்ரொசீஜராக இருந்தாலும், எந்த மெடிசனாக இருந்தாலும், இந்த மருந்து ஒரு ஆளுக்கு கொடுத்தா எத்தனை பேருக்கு கொடுத்தா ஒரு ஆள் இம்ப்ரூவ் ஆவாங்க, அதான் NNTன்னு சொல்கிறது. மாடர்ன் சயின்ஸ்லேயே த்ராம்பெக்டமி தான் NNT இருக்கிறதுலே கம்மி. 2 பேருக்கு கொடுத்தா அதில் ஒரு ஆள் இம்ப்ரூவ் ஆகிடுவாங்க. ஸோ there is something, paradigm shift has happened. So take it to the people. Your pen has value. Take it to the people. Tell them that, okay, stroke is important, now we can treat it completely. Then stroke ready hospital, it's pretty important. With due respect to all the hospitals, but then it's not that reaching hospital is important. It's the awareness about where nearby, in which, if your residence is nearby, which hospital is stroke ready is important. Not that you go to a hospital where it's not ready, then you have to go to another hospital. Make it awareness about stroke ready hospital. Stroke ready hospital is a new concept. It has come only for a year. So make sure that be aware of stroke ready hospitals in the neighborhood. Then two values: thrombolysis 4.5 hours, thrombectomy 6 hours, in selected patient 24 hours. And these are the risk factors except one, that is age. All the other things are reversible. Age, you can't do much about it. Thank you. Why time is important and why you should not waste time. That is the reason why he is here. Please. He is a wonderful orator.
Good afternoon, guys. My name is Deepak Kumar Nair. I'm basically a lawyer. I've moved from different fields, law being one of them, a stockbroker, and a movie producer now. Well, how did I get the stroke, or rather, how did I know I had stroke? I had a headache the right side of my head for a period of approximately 15 days. I took it very light. I kept driving around. A little by little, I kept losing sensation on the left side of my hand. In spite of that, I kept driving. I would drive all around the city with all my different functions and programs and related work. Didn't take it too serious. I thought it could be maximum kind of maybe the sleeping position. Since my dad was a patient of Dr. Prabhash, I took a chance of giving him a call and said, I have an issue. So I said, I wanted to see you. He asked me to come in there. I couldn't drive, so I had my brother drive me by that point of time. When I met him, he asked me if how the function of the hand was, and I found that the hand wasn't moving too well. It was completely numb. The left side of my hand was completely numb. I couldn't move the hand. He had a doubt. He said, why don't you have a neurological checkup of the hand, where the nerves of the hand, he just wanted to find out if there was a sleeping arm, which most people get if you have it around the back of your chair for quite some time, you find your arm freezes. So he thought that could be one of the reasons for this entire thing. I had that checked. There was nothing wrong. And the next suggestion from him was, he said, I want a CT scan done. And I want it done right now. I was trying to delay the entire thing because to be very honest, I didn't think I would have a stroke. I was pretty fit. I'm not a diabetic. I don't have hypertension, no cholesterol, no BP. I don't drink. I don't smoke. So these are all supposedly symptoms of stroke. So I didn't want to take it too seriously. But he said, no, I wanted to get a CT scan done. Way into the night, around 12:30, a friend of mine dropped me at a scan center which he had referred, and I got this CT scan done. Half an hour down the line, the guy had called up the doc, informed him directly, and he wanted to speak to me. So he said, I want you admitted in the hospital right now. I said, come on, doc, tomorrow. He said, no, go right now. And by which time, it was close to 3 months after my first headache started. So he was pretty worried. So he had me admitted in the hospital. I was admitted at Vanagram Apollo. And there he discovered that, yes, there was a block. There was a 90% block of the M1 artery, which was quite a serious thing. Well, how would I say? It was a scare. Initially, when you hear you have a stroke, you think, what the hell? You don't get it. But then it happened. Now, the cause as to why I got the stroke, well, that is something which, well, as he said earlier, the symptoms for stroke are all these things which you tend to miss out on. If you have diabetes, if you've got BP, you've got hypertension, you've got cholesterol, or if you're a heavy drinker or a smoker, your chances of stroke are pretty fast. You could have any of those ailments which attack your heart or your brain. But I had none of these, and I was pretty fit. Why did this come? Well, I'm into stress-related work. Being a stockbroker, I'm into high-stress operations as far as the market is concerned. And subsequently, when I got into movie production, that again is highly stress-related. It's not easy when you have huge amounts of funds parked outside and you wait for these damn things to come back in. Give you a lot of things well, the perception has changed now. You realize these are things you take too lightly. And I've understood that symptoms can vary. One person's symptom does not necessarily mean that you need to have the same symptom to get a stroke. Symptoms change for person. Some people can have a memory loss completely and then you determine these certain things. My symptom was this particular thing, which I found very surprising in terms of other health reasons, but this was one. How did I go about it? I had it surgically removed by, what is it called? Thrombectomy. And there was no necessity of a stent. There was a discussion of having a stent in the brain, but thankfully there was no stent or anything implanted in the brain. So there's no metal there. And I'm back to normal. But then what are the fallouts of this particular thing? I do have memory losses. As he said, every hour, every minute you delay this entire procedure, you find that something kills a certain amount of your brain cells. And I've delayed it for quite some time. I do have memory losses, which take place very often. Sometimes, I used to pride myself on having an excellent memory. Unfortunately, now when I do check on certain things, and especially when it comes to in relation to law or financial matters, I find that I'm not able to place certain things. Subjects of the law, I'm not able to actually recollect. Certain case studies, or even in relation to certain acts, I'm not able to recollect them offhand. I need to research them. These do happen. Over a period of time, I found that the sensitivity to my left hand has come back to almost normal, except for maybe one finger, which hasn't yet come back to 100% normal, but then it does take its time. The cells do regrow. Thankfully, your human body is such that it regenerates, and with brain cells, they do regenerate wherever it's possible. And with the right treatment and medication, I'm sure we can get back almost 99 to 100% of the, hopefully that's what I expect. Now, what would I ask or suggest for patients who have had a stroke here in India? There's no major knowledge on the subject as far as the public is concerned. People do not have an idea as to what it is that has happened to them. People realize it late, and subsequently, after you've had a stroke, there's absolutely no support group here in India where you can actually sit and discuss with others about the causes of this entire thing, the symptoms they're facing, and the post-traumatic stress they go through in terms of this particular illness. If there were, it would help people to realize what exactly they have gone through, how they can adapt to the situation. Some people do not get full functionality of most of their organs or other things. But people who have gone through it, if they can have actually some kind of thing, which they were trying to work out in terms of having a support group with their patients of Apollo Hospital, so they can understand what exactly the symptoms are and how to go about the entire thing, people who had issues with it, how they can be handled. The caregivers of the people who've had the stroke, in fact, they are the ones who actually go through a lot of stress. The person who's had the thing does not actually go through it. If he survives it, yes, good enough. If he doesn't survive it, it's the caregivers around them who actually have a problem. Well, what can you do to prevent this thing? The standard things: smoking, alcohol, BP, diabetes. These things are causes for this. If you can work out, there is nothing like ensuring, if you have your regular exercises, you're walking, running, or playing a particular sport, it really helps. It really helps keep you fit. But then, of course, in spite of all that, as there was a story, there's a small joke which goes around. One Mr. Iyengar, who actually is a master, he's a teacher of yoga. He lived until the year 96 years of age. But there was Kushan Singh, who's an author, who lived until he was 101 in spite of drinking whiskey on a daily basis. It all depends on your genes. But then if you do tend to take your respective effect to ensure that you don't get into that, good. Thank you. I hope, if there are any questions, do ask. I should be glad to answer them.
Thank you, sir.
So you heard from many different people and patients. So just to avoid this time delay, it's a combined effort from several of us to launch this ApolloConnect. We would like to officially launch the ApolloNeighbourhoodConnect app.
Thank you. Thank you for everyone. Please join for lunch.